Okay, this is the video competency for the minor surgery competency for MA 180. The first thing that you'll do is to go into the other room and do a medical aseptic hand wash like we always do. The second thing will be to gather your equipment. You're going to need to gather a surgical kit, okay, a surgical tray that's designated for this procedure. You will also need on your side table sterile gloves, your black pen, a specimen container. You'll need a lab slip to fill out, an encounter form, and your patient's chart. Okay? You'll also want a container to put in your soiled instruments after the procedure is over. Okay? For this competency, what we're going to do first then is to gather our patient. So I'm going to call my patient and verify his date of birth. Mike Simcox. Hi Mike, how are you?
I'm great.
Good. Thanks. You want to have a seat up here on the table for me, please? Thank you. Mike, can I get your birthday, please?
1772.
Okay, excellent. That's what I have here in your chart. We're going to get you set up to have that mole taken off, sure. Okay, today. Actually, it's a lipoma on your arm that we're going to remove. So I'm just going to get some things set up, okay?
Okay.
Do you have any questions before we begin?
No.
All right, so I have everything together. So you'll want to make sure that you have a blank lab slip, that encounter form, and your patient's chart because you're going to do that documentation there at the end. So once I have my patient in and ready, the next thing I'm going to do is set up my sterile field. And I want to do it in a manner to where I can get to my gloves and maintain my sterile field once I have everything put together. So this is the kit where you filled out the little surgery card, and you're going to set up this kit to be laid out just like the surgery card show. So we're going to open this in a sterile manner. I'm going to open it away from me to begin with. And then one side, the other side, and then closest to me last. Now, let's say my sterile field didn't open properly, and let's say we have kind of a wrinkle on my sterile field. You need to know how to be able to properly adjust your sterile field. So for instance, what I can do is this is all considered sterile within my 1-inch border. I can go ahead and come over here and pull that down. Remember though, you can't take this and pull it over because this was non-sterile and we can't make it sterile, okay? So if I had a little wrinkle up here, I wouldn't want to reach over my sterile field and fix that. I'd want to come down and around and I can pull that down. See how anything that was sterile can become non-sterile, but anything that was non-sterile cannot become sterile. All right, so for this, like I said, procedure, I have my patient in here, I've identified date of birth, I have my sterile field open, so the next thing that I want to do for this procedure is to sterile glove. So remember, I have sterile gloving already been proven as a competency, so we need to make sure that we don't have any errors in gloving. So you want to continue to practice your gloving throughout. So the first thing I'm going to do is open up my sterile gloves, step back so I can see both sterile fields, simulate my surgical hand wash, which again is the only hand wash you're allowed to simulate, and then I'm going to put my sterile gloves on in a sterile manner. Okay, now with my sterile gloves on, the next thing I'm going to do is I want to take all the instruments out of my tray. The tray is just to hold the instruments. I don't need it for this procedure, so I'm going to step back and drop it. It's going to be loud. I don't want to set it down because then my hand goes below my waist and now my hands are contaminated. So you just drop it from basically chest level. And then most of your instruments are going to be on a hook. I'm going to take the hook off because I don't need the hook as well. And I'm going to do the same thing. I'm going to drop it without contaminating my hands. Now I'm going to proceed to set up my sterile field the way it is on the card. I want to make sure all of my ratchets are locked as I place them on the sterile field. So you'll do this from memory. Hemostats go first. My hemostats are curved. These are actually curved Kellys. So I want to make sure the curvature goes up and not down. All of the handles should be pointing towards the edge of the sterile field. Okay, so that's ease for grabbing, so you're not grabbing in the middle of the sterile field at the handle. Does that make sense? Okay. This goes at the bottom, and this here, and this here. Oops, one more top clamp. Same with my towel clamp. So I have all my handles out towards the edges, everything in the proper order, scissors, needle holders, tissue forceps, dressing forceps, sponge forceps, and my scalpel blade pointing towards me. All the curvatures up, all the handles towards outside, and again, that's the card that you just copied in class. All right, so now that I have my sterile field set up, this is the question and answer portion, okay, that we have with the provider. Okay, I used to do handing instruments. We'll still do that. So I'm going to ask you for a particular instrument while we're in there. So I might ask for the bandage forceps. So you'll need to know what the bandage forceps is, and you need to hand it to the provider in the proper manner. So what's the proper manner? You take the top of the instrument so he can just grab the handle, okay, not too high, okay, to where he's barely got it, not too low to where he's got to back it up. Does that make sense? Okay, a nice flick right here across those knuckles to the provider so they know that they have it. Don't push it in, don't wimpy put it in their hand. A nice flick so that they have it and their hand will naturally close around it. When something hits you, you kind of naturally grasp at it, right? So that's what we're looking for. So a nice flick so that they can go to use it. So let's say I asked for the needle holders. I want those handles to hit that same spot of the provider. So my hand above and kind of like a flick right into it. See how that's kind of like an angle lever type of motion, okay? So that the provider then can use it. If you are asked to handle the scalpel to the provider, you want to hand it to them in a fashion to where the blade is down, so when they grab that scalpel they can go down and that blade is towards the patient. Does that make sense? So you don't want to hand it in this fashion where the blade is facing the provider, because then they're going to have to turn it. All right, so handing instruments is something that I do want you to practice. You'll also need to know what the instruments are, but everybody should have at this point checked off on instrument identification. You'll need to know the parts and pieces of the instrument for the question and answer portion. I typically ask students to hand me 3 instruments. So I'll pick 3 random items and I'll see how you hand them to me. And then I'm going to ask you those instrument questions. What are ratchets? What are teeth? What is this instrument used for? What classification is it in? Grasping, clamping, dilating, probing, or cutting. What might this instrument be used for in the office? Okay, what is this part of the instrument called? So those are all the different questions that I will ask on instruments. So I'll ask about 3 or 4 questions on instruments. Then I'm going to ask about 3 or 4 questions on sterile principles. What is my, what's an acceptable border on my sterile field? What do I do with these instruments as soon as I'm done with them? If I have a cold today, can I go ahead and assist the provider? What if the provider accidentally contaminates the field? What do I do? So 3 or 4 questions on those sterile principles that were in your textbook, right? And then the last 3 or 4 questions that I ask are typically on that sanitization or disinfection process of these instruments. Those were the steps that I went over specifically in class, okay? As soon as we're done with them, we're going to soak them in a blood dissolving solution. When we do the sanitization, it's a soft brush, and that's the physical scrubbing, disinfection steps, and procedures. Okay, so everybody will have about 10 oral questions given at this particular time, okay? When that is done, the next thing that you're going to do is I'll say, okay, we're done with questions. You can go ahead and clean up. So what you'll do then is you'll take each and every one of the instruments, open the ratchets, and put them in our solution over here, which is just a pretend solution. Put them in that blood dissolving solution, and we have to make sure the ratchets are open because that's one of the steps as far as disinfection. All right, so make sure everything's nice and open, and we'll place them in our blood dissolving solution. That is your cleanup process. You notice I still have my gloves on. You want to leave your gloves on for this, right? Because they're contaminated. All right, the provider has left, and I'm just going to soak these until I can sanitize and disinfect them later. This would go into sharps, but for now I'm going to throw it in there. So the next step that I'm going to do now is remove my gloves and remove them properly. Again, grab the palm of the first glove down and in front of me. Make sure it comes off inside out. Inside out. Set that aside. Now I'm going to wash my hands. So you can either go into the other room and actually wash your hands, or I will allow you to use the sanitization soap just for time's sake, because the next and last portion is going to be your documentation of this procedure. So the documentation for this procedure is filling out that lab slip, and we highlighted everything that you were supposed to do. We did that in class. filling out your encounter form. We highlighted, this is a demonstration on what should be circled on that. So today's date of service, the patient's name, the patient's date of birth. What you're going to circle for this is the same procedure code, the 99212. You're also going to circle over here that we had a skin biopsy done. Okay, so skin biopsy and also specimen handling, because that's what this specimen container is over on your side tray. This would be to simulate like a jar of formalin, and then we took whatever specimen from the patient and put it in here. Okay, and then I have also on here that you need to look up the code. I said at the beginning, not very well, but I said at the beginning that this was going to be a skin lipoma, and we're going to say this was a skin lipoma on the patient's right arm. So on this lab slip, it's real important that up here at the top where it says clinical diagnosis, you write the name of the diagnosis. In this case will be skin lipoma. At the bottom, it's asking for the site. That's where right arm goes. For all of these, they're going to be excisional. So in your offices, it'll be whatever it'll be. But for here at SWIC Family Medicine, it's going to be excisional. And then up here in this box right here is where you're going to put the ICD-9 code. So I'm going to tell you when we do this checkoff, okay, today we're going to remove a skin lipoma right arm. You need to know that the word skin lipoma goes here, which is the clinical diagnosis. The site goes here. And then you're going to grab an ICD-9 code book, which I'll have on the shelf, and you're going to look up the diagnosis code for skin lipoma, and those numbers are going to go in the ICD-9 code box. All right, so that's all part of your documentation. Then in your chart, you're going to document date and time, removed skin lipoma from patient's right arm, specimen sent, to Quest Diagnostics. And then you're going to sign your name, first initial, last name, and that's what our documentation is going to entail. The reason we do that is because then if the patient calls back, Mike calls back in 2 days and says, hey, is my specimen back? That lipoma you took off, was everything okay? I can look in his chart, and I'm going to look under lab. Nope, it's not in here. And I can look on the progress note, and I see which lab we sent it to and what it is exactly I'm looking for. So that's going to help me gather those results, okay? So documentation of the progress note, documentation of the encounter form, documentation in the chart for this procedure. All right? All right? That's good. Any questions?